We have 3 or 4 main things that we focus on in my lab. The most fundamental thing we focus on is how blood flow increases to skeletal muscle during exercise. At rest, blood flow in your skeletal muscle is, say for discussion's sake, about quote 3 unquote per minute. During exercise, it can increase 100-fold to a value of 300, and the units are 300 mLs per 100 grams of muscle per minute. That's a 100-fold increase. So there are all sorts of substances released by your muscle as they start to exercise and need more oxygen that cause those blood vessels to open up. And so our question is, what are those substances? How do they operate? And how do they change? Men versus women, young versus old, athletes versus non-athletes? Are they different in people and disease? So that's one area we're interested in. Another area we're interested in is blood pressure. Why are some people's blood pressure low? Why are other people, do they have high blood pressure? And why are some people not able to stand up? Why do they faint? Is there a difference? How do these things change with age? We've recently discovered some very, very interesting differences between younger men and younger women, and now we're moving on to study older men and older women. And then something I'm very, very excited about is there are receptors in your neck that sense the oxygen levels in your blood. When the oxygen levels are low, you take a big deep breath and your ventilation is stimulated. And this is what happens when humans go to high altitude. It turns out there's at least some evidence that these same receptors sense how much glucose is in your blood. And when your glucose levels fall, they're responsible for making your glucose levels come back to normal and perhaps stimulating you to eat. So we're just embarking on studies about how these receptors sense glucose in humans and what role they might play in controlling glucose in your body. Now this is obviously important because it could have implications for people with diabetes or other diseases where the control of glucose is messed up.